Namaskaram and very warm good evening to everyone. Myself, Vinosh Paul, outside Kerala Sales Coordinator, and I'm honored to be your host for this session. On behalf of Oushadhasala Private Limited, I extend a heartfelt welcome to all our respected doctors, Ayurveda practitioners, faculty members, students, and distinguished guests who have joined us today for Oushadha Sameeksha monthly Ayurveda webinar series. Thank you for taking the time to be with us. Today's session focuses on a highly relevant topic, fatty liver and its management in Ayurveda. Before we begin, if you have any questions during the session, please post them in the Q&A section and they will be addressed during the interactive section. Now, it's my privilege to invite Mr. Jayakrishnan Nambi, Senior Marketing Manager of SN Oushadhasala, to deliver the welcome address. Sir, over to you.
കേൾക്കാനില്ലേ?
Yes, sir.
നമസ്കാരം. Respected speaker, esteemed participants, ladies and gentlemen, good evening. On behalf of SN Oushadhasala Private Limited, it is my great pleasure to welcome you all to the 4th edition of Oushadha Sameeksha monthly Ayurveda webinar series. We are delegated to have with us Ayurveda physicians, academicians, researchers, students, healthcare professionals, and special dignitaries from different parts of India and abroad. Your enthusiastic participation reflects our shared commitment to learning, collaboration, and the advancement of Ayurveda. Today's webinar focuses on fatty liver and its management in Ayurveda, a topic of great relevance in today's world, where lifestyle-related disorders are becoming increasingly common. Ayurveda offers a holistic approach to understanding and managing such conditions through personalized treatment, proper diet, and healthy lifestyle practices. We are confident that today's session will provide valuable clinical insights and practical knowledge for all participants. It is our privilege to welcome our distinguished speaker, Dr. Mukesh P. MD, Ayurveda, PhD, Professor, Department of Roganidana, VPSV Ayurveda College, Kottakkal. Sir is a highly respected academician and clinician, and we sincerely thank you for accepting our invitation to share your expertise with us today. I also extend a warm welcome to our moderator, Dr. Anushree Muralidharan, MD, Manager QC and QA, SN Oushadhasala, who will guide today's session and facilitate the discussion. At SN Oushadhasala, we believe that sharing knowledge is one of the most effective ways to strengthen Ayurveda. Through the Oushadha Sameeksha webinar series, we aim to create a platform where experts and learners can come together to exchange ideas and promote evidence-based Ayurveda practice. I encourage all participants to actively engage in today's session and make the most of the discussion and Q&A segment. Once again, I extended my heartfelt welcome to our esteemed speaker, moderator, and all our participants. Thank you for joining us. I wish you all the highly informative and enriching webinar. Thank you.
Thank you very much, Mr. Jayakrishnan Nambi, for your warm and inspiring welcome address. Now it gives me immense pleasure to introduce today's eminent speaker, Dr. Mukesh E. He is a professor in the Department of Roganidana at VPSV Ayurveda College, Kottakkal, with over 14 years of teaching experience. He is also the director of Kottakkal Ayurveda School of Excellence, leading the development of ATAB certified training programs that promote practical and advanced learning for Ayurvedic practitioners. He holds a BIMS from SDM College of Ayurveda, Udupi, and an MD in Roganidana from Government Ayurveda College, Kannur, and a PhD from SES VMV University, Kanchipuram. Today, he will enlighten us on the topic fatty liver and its management in Ayurveda. We are honored to have you with us, sir. Sir, the virtual stage is all yours.
Thank you. I hope the slides are visible.
Yes, doctor.
First of all, I would like to thank the organizers for inviting me for a talk on fatty liver and its management Ayurveda. So, respected doctors, experts, faculty members, practitioners, we all know that this is a very hot topic in the current era. Recently, a 14-year-old boy came to my clinic and he underwent a routine ultrasonogram for some other issues and was found to have grade 1 fatty liver. So that is the seriousness of this issue. Even very young age, at a very young age, our people are starting to develop fatty liver. So why this is happening? Is there anything wrong with our diet and lifestyle? Obviously, which we know that there are something that is not right. Or are there any other factors which we are overlooking that is leading to such a type of prevalence of this condition? Maybe one factor is that our diagnostic facilities have improved much, so maybe that is enabling some of the detection. But still, when I used to learn my BMS, say 20 years back, at that time this was a disease of people above age of 45-50, but now we get patients, as I told, even below 20 years of age. So that is why this is a very important thing that we have to address. And Ayurveda, as mentioned earlier, has a lot of things to offer in management of fatty liver. So when we get a patient with fatty liver, we can get these patients at various time points of the disease pathogenesis. Sometimes we may get these patients in a grade 1 stage, or sometimes we may get the patient in a very end of life stage where the cirrhosis have set in, there is portal hypertension and complications, and the modern medical system has told that there is nothing much to do. Then the patients may come. So an Ayurvedic physician is bound to get patients with fatty liver at any point in the timeline of the disease. So we should be prepared and we should know how to manage these conditions. But there is an important issue. None of our textbooks have a condition named fatty liver. Obviously, we have a very discrete reference regarding Agridhodara, which indicates hepatomegaly, and that can be due to any of the causes that can lead to liver enlargement. So the question is, how do we decipher the pathogenesis based on our concepts, and how can we manage these patients, diagnose and manage these patients? So within next 35 to 40 minutes, I will just take you through some of the basic concepts. I may not be naming or giving you names of medicines, that means shortcuts, you give this medicine and the fatty liver will be cured. No, as Dr. Jayesh Nambi already told that this Ayurvedic treatment always offers customized treatment. So we cannot say that a single medicine is a solution for all the issues. That's not possible. So the new name is MAFLD, or Metabolic Dysfunction Associated Fatty Liver Disease. So previously the name was NAFLD and now it is being reframed as MAFLD. If you take some 5 to 6 years or even 10 years back, even modern science used to consider this fatty liver disease as a separate entity. But now the studies have been proving that this is a part of a larger spectrum of metabolic dysfunction. You may call it as a syndrome X or a metabolic syndrome. so which constitutes a constellation of features including diabetes, hypertension, then dyslipidemia, coronary artery disease, and all the related stuff. So that is why the nomenclature has been tweaked recently into metabolic dysfunction associated fatty liver disease. And since the term liver disease is there, obviously it's a spectrum of liver disorders where the main characteristics is the accumulation of fat in the hepatocytes. And if you look at the global burden, around 25 to 30% of people with metabolic dysfunction have liver involvement, and we can say that it's a silent epidemic that's going on. So the problem with the liver is that even if a small part of the liver is functioning normally, the body may not show any of the symptomatology. So this is a very big challenge, especially for us doctors, to diagnose this in early stages. Obviously now people go and do ultrasonography for other even trivial symptomatology, so we may be able to pick the condition, but most of the times this is a very silent disease process, and unless and until the hepatic function is totally deranged, the patient may not show much symptomatology. But there are some very minute things that if we look into, we can identify this in an early stage, which we are going to discuss. So there are different terminologies. So one is NAFL, non-alcoholic fatty liver, or it's simply known as steatosis. So there is no actually hepatocellular damage that is happening, but there is fat accumulation. Then there is steatohepatitis, where there is hepatic steatosis or fat accumulation, and along with that there is an inflammation which leads to the injury to the hepatocytes. So if you look at the prevalence in obese patients, 75% of them, MAFLD can be seen. In type 2 diabetes, 69%. And another issue is that among these patients, only 10% of them can go to an end stage liver disease. But before that, these people can develop coronary artery disease or even cerebrovascular diseases and so on. And some of them are even predisposed to malignancies. Obviously, I think everyone who is attending this session today will be knowing what are the risk factors: sedentary lifestyle and excess calorie intake. This is the biggest villain that leads to fatty liver, because there is something called as a thrift gene hypothesis. If someone of you are interested, you can go and read, because it's something that is ingrained into our genes, that whenever there is excess energy available, the body is trained to store that by converting it into fat and putting it as a deposit for future use. But now what happened, because of the great epidemiological shift that happened, previously if you take 100 years ago, there were worldwide scarcity of food and there were diseases of nutritional deficiencies. But now the present scenario is totally opposite. Even very poor individual may have access to good food, except in some parts of the world. So there is excess calorie that is not needed for our body. So definitely this is going to get stored somewhere, right? So there is a genetic susceptibility that can trigger this process in susceptible individuals. Then central obesity and insulin resistance also has a role to play in the pathology. Type 2 diabetes, obviously, that increases the risk and progression of this disease, and dyslipidemia and hypertension, they are friends, right? They will be always together. And the recent studies also says that whenever there is a shift in the gut microbiome, these unwanted or unhealthy gut microbiome can release inflammatory mediators, which can lead to chronic low-grade inflammation, which triggers an entire cascade of events in the body that can lead to inflammatory changes in the vessel wall, as well as this pathogenesis leading to fatty liver. And there is a new term in the circle, that is metaflammation. So this is nothing but chronic low-grade metabolic inflammation. And this metaflammation is believed to trigger a lot of chronic diseases. Even it is believed to trigger autoimmune diseases like rheumatoid arthritis. So when Ayurveda told that Roga Sarvebi Mande Agno, if you tell this sloga 10 years back, people used to laugh at us. But now, even the modern medicine with all these researchers, they are going back to the gut theory, where everything is dependent upon how you modulate your gut, right? So a persistent metabolic overload can activate macrophages, cytokines, and there are studies that says that adipose tissue itself can act as an independent organ, and which triggers an inflammatory process, further leading to inflammatory changes in the liver cells or hepatocytes. And it can also induce endothelial dysfunctions in the blood vessels, leading to atherosclerosis and resultant complications. So all these things together, they can trigger insulin resistance, diabetes, then liver disease and cardiovascular diseases. And if you go through the references regarding Annavisha and Ama, and if you take Charaka Chikilsa 15th chapter, Grahani Chikilsa, he says about the after effects of Annavisha, right? So if you look through that, there are comparisons. So I'm not going to compare one-on-one that Annavisha is toxic metabolites, no. But when you implement the therapeutic protocols that are aimed at correcting the Annavisha or Ama, patients are getting results. So there is something that we have to address, give our attention into. And if you look at the modern pathology, there is fat accumulation in the hepatocytes. Then comes the ballooning degeneration and inflammation in the lobules. Later on, what happens is there is onset of fibrotic change in the liver, and this constant fibrotic change and repair can lead to cirrhosis. So advanced fibrosis can always end up in cirrhosis and result in portal hypertension. And if you ask what is the gold standard to diagnose, obviously liver biopsy is the gold standard to diagnose, but there are a lot of other measures like fibroscan, etc., which can aid in a probable diagnosis of this condition. So these are the stages. Initially, excess energy or glucose. All this glucose gets transferred into the periphery, converted into fat, and this fat accumulation can slowly trigger insulin resistance. And once the adipocytes enlarge, there is release of free fatty acids, leading to hepatic deposition. So these free fatty acids can get deposited in the liver. This further initiates another cascade of hepatocyte injury and inflammation, and ultimately there will be coexistent systemic inflammation leading to ischemic heart disease, diabetes, hypertension, in females PCOD. Then comes the main pathology in the liver, which is the fibrosis, so that the architecture of the liver is distorted and ultimately lands up in a phase of cirrhosis. And if you look at examination findings, usually in the early stages, there will be subtle signs that we have to look into. One is obviously obesity. Some patients can have acanthosis nigricans, and you can look at the neck, axillae, etc. of the patient, where you can see small skin tags. So these skin tags can be a clue that this patient has a chance of developing insulin resistance and other complications. And some patients may also have mild hepatomegaly. So some patients comes to us and tell that they have a feeling of fullness of the right upper quadrant. So we may think that fatty liver is usually a painless pathology, but once this starts stretching the capsule of the liver, then it can cause a stretching type of feeling. Some patients have explained it like that. And once the stage of metabolic syndrome ensues, then there is abdominal obesity, hypertension, then there is hypertriglyceridemia, low HDL values, diabetes, and there may be a very evident hepatomegaly. And in the complication stage, usually whenever there is portal hypertension, there are a lot of clinical manifestations that can happen, including ascites, spider nevi, palmar erythema, jaundice, pruritus, splenomegaly, and this may land up in a hepatic encephalopathy as well. And if you speak about the investigations, Usually, whenever you suspect a patient, these are the tests that you should do. One is fasting glucose, the other one is HbA1c, lipid profile, liver enzymes, and an ultrasound of the abdomen. Usually, in these phases, there may be a normal or borderline increase of glucose. There may be dyslipidemia. Liver enzymes, especially SGOT and SGPT, may be slightly raised, and the ultrasound may show a fatty infiltration. During the metabolic syndrome stage, again, the investigations are almost similar. You can also add a fasting glucose or an oral glucose tolerance test. HOMA-IR can be calculated to identify insulin resistance. Lipid profile, obviously everyone knows, and we can also go for an elastogram or something called as a fibroscan, which identifies two parameters. One is a liver stiffness measurement, which gives you an idea about how much stiffness the liver has developed. And second one is CAP, which gives you an idea about how much fat is deposited in the liver. So CAP stands for controlled attenuated parameter, controlled attenuation parameter. So this value, usually it is less than 238 decibels per meter, and the upper cutoff is 290. So the bottom is 238 and the upper is 290. If it is below 238, there is no much fat. That means it is less than 5% fat. And if it is more than 290, then it indicates that there is a severe fat deposition in the liver. So that is CAP value. Then the liver stiffness measurement, it is expressed in kilopascals. So the normal is below 5.5 and abnormal is above 5.5. That means between 5.5 and 12.5. Anything above 12.5 should be considered as a overt cirrhosis of the liver. And then there are gradings and classifications, which I am not going into detail because it will be available online. You can Google it and you can learn the values. So these are classified in different gradings. So we can write a fibroscan and see how much the liver is involved. MRI also can be done, but that is not usually done as a part of general practice. In the complication stage, obviously we will go for the liver function test, then platelet count, then PT-INR, because INR gives you an idea about the extent of liver failure. Then USG, CT, etc. as routine that we say, and an alpha fetoprotein will also give you an idea about whether there is any malignant transformation of this process that is going on in the liver. So that is regarding the modern, what they say about metabolic dysfunction associated liver disease. Now let us look at the Ayurvedic approach. So how can we identify the Nidana, Samprapti and Chikitsa? So Nidana we know, right? Excess calories, then refined carbohydrates, fructose rich fruits. So if you look through the Sandarpani Adhyaya, actually the process of fatty liver, we can see that happening when one doesn't follow what is told in Trivida Ukshiya, and when someone follows what is told as Nidana for Sandarpana, Adi Sandarpana. So we are accustomed to all these Sandarpanakara Ahara Viharas. So Snigdha, Madhura, Guru Pichila, Navannapana. So previous generations used to store grains for some period before using it for consumption. But now we directly get from the field and we use Navannapana, right? Then red meat and all those things that we use now. Cheshta Dveshi, so sedentary life habits. Divasupna. So all these things leads to Sandarpana. And when we think about this process of Sandarpana, this doesn't start in adulthood. When we have a baby, the current moms or mothers, they don't like the baby to cry, right? So what they do, whenever the baby cries, they will feed. They think that the baby is crying because of hunger. And even some moms, they doesn't want their baby to cry, so they keep on feeding. So this Sandarpana starts from the childhood, early infancy. And there will be one stage where the body cannot handle this much nutrition ultimately the mechanism fails, right? So here the Sandarpana should be interpreted as metabolic overloading. So we are giving to our body what's not necessary. We are giving something more than enough to the body. And if you look at where this process leads, this is a very interesting thing in our classical textbooks. Sometimes the complications may not be evidently found in the description of the pathology, but sometimes it may be found in the indications of the formulations mentioned in the particular context. So if you look at this Vyaushadhi Yoga, which is explained as a treatment in the Charaka Sutra Sadarpaniya, you just look at all the indications that is given by Charaka. Prayogadasya Shamayandi Roga Sandarpanotida. Then what are the rogas? I have just highlighted those things that are necessary for our today's discussion, but you just look at these things, almost all these things are more prevalent in the current society. Prameha, see Kamala came there, Pliha, Pandavamaya, Shofa, Hridroga, Grahani Dosha, Staulya. So you just look at what are the things that are generated by Adi Sandarpana. So Adi Sandarpana can always lead to all these diseases. I just highlighted important points. I am not correlating one-on-one, or I am not claiming that whatever is found out by the current modern research is already available in Ayurveda. No, I am not saying like that. I am not a person who claims like that. But there are references which helps us to identify all this samprapti in the patients. Now just go through the reference of Gramya Hara explained in Charaka Rasayana. Same thing is also explained in Ashtanga Sangraha Rasayana Adhikara. So this one sloga, one line is very, very important in the context of fatty liver, because we know that Sandarpana can lead to Kapha and Medo Dushti, right? But we know that Yagrit is a sthana of Raktava Srodhas. So now the question is, how can Sandarpana affect Yagrit, right? So this is where the concept of Gramya Hara will come into play. So in Gramya Hara, the consequences, he says, Vidahyade Raktam. So when we go and use all these Amla, Kadu, Ushna, Aharas, Pishtana Bojina, we take all these Idli, Doshas, all these Pishtana Bojanas, ultimately can lead to Vidaha in the Rakta. Vishyandade Chanalpam Medaha. It causes Vishyandana. Analpam Medaha means Meda is excessively increased in the body, right? So all these processed food, inflammatory diet, this is a new term, the diet that can induce micro level inflammation. So now dietitians are claiming that there are a lot of dietary items that can work against. So a whole array of anti-inflammatory diet has been proposed now. Excess salt and sour foods. Then comes the concept of viruddha, that means incompatible foods. And now see what happens when there is medo vriddhi. First is ada eva udare vriddhim, there is abdominal obesity, right? And there are people who doesn't have any obesity in the extremities but only in the abdomen, right? So eva udare vriddhi. And then later on what happens? Medasavrda margatvat vayuhu koshte visheshata. This will further trigger the appetite. So this Medasavrda vada can fuel the Agni and the person becomes a voracious eater. So this we can see in the early phases of insulin resistance, where individuals start eating more. People who didn't like sweet taste in their early childhood or adulthood, later on becomes people who crave for sweet taste, right? And then it can ultimately lead to what happens? Kala Vedikramat, there can be Vigaram Shapnude. There are plenty of complications that can happen when the Medo Vriddhi is not reversed. So that is why Medasyadiva Samvriddhe Sahasaiva Aniladeha Darunan Kritva Nashetyashu Jividam. So this can lead to diabetes, cardiovascular complications, stroke, etc. etc. Also, we should look into the context of Viruddha Ahara when we look at explore the Nidana, where he says about Udago Udaranam, Murcha Mada, Ama Vishasya. So all these things are consequences when you habituate Viruddha Aharas. So toxic metabolites can lead to chronic inflammatory state. Then you should also look into a cross reference from Vidishonidhyadya, where he says about Viruddhanam Upaklinna Podinam Bhakshanenacha Diva Praswapadam. So Diva Swapna not only insults kapha, but it can also insult rekta. Dravasnigdha Guru Nija Atyadanam Tada Krodham. So emotional factors that fuels. So Vidahi, Snigdha, Drava, Ushna Aharas, and also emotional factors that can lead to Rekta Dushti. And if you look at the reference of Yagrit Udara, Yagrudha Udara, again the same thing comes here. Vidahi, Abhishandhi Radasya Jandoho, Pradushtam Atyartam Asrik Kavasya. Okay, so here the Kapha and Asrik, they come into play and then leads to Yagrudha Udara. So this is what happens in the current scenario, where overnutrition along with use of items that are insulting to the Rekta can lead to simultaneous dushti of kapha and rekta, ultimately leading to the involvement of Yagrit. So if you look at the timeline, you see Gramyahara, Viruddhahara and Sandarpana leads to formation of Ama or Annavisha, Kapha as well, Vishyandade Chanalpam Medaha. So then the next phase the patient will have Prameha, Staulya, and this Kapha Meda can cause Avarana, leading to myocardial infarction, stroke, renal failure, etc. etc. And if at all, if Rekta Dushti happens, then this patient goes into the hepatic. 90% of the patients will end up in the third phase, that is Prameha, Staulya, Avarana and its complications. And if the patient has been habituated to take Rekta Dushtigara Ahara Viharas, they will go into the phase of fatty liver. And ultimately where this ends in a stage where there is a advanced hepatic disease which can be considered as Kumbha Kamala. So Kalandarat Kariboda Krichrasyat Kumbha Kamala. So here it indicates advanced steatohepatitis, fibrosis, cirrhosis along with icterus, portal hypertension and ascites. So this is a beautiful timeline that we can see later on. Then there is another phase that is known as Halimaga, which indicates chronic liver failure, or it can also be considered as early decompensated cirrhosis. This is not only specific to fatty liver, but this phase can happen to chronic liver disorders due to any other causes as well. Because our Ayurvedic nosology is all about disease spectrums, not about one-on-one correlations. So here you can see Haridaha, Shavapidaha, etc. etc. Then you see a feature Strishu Aharsho. You can see because of the testosterone deficiency that happens in chronic liver failure, there can be reduced libido and sexual desire, and even male patients, they can develop gynecomastia as well, right? So this is a phase of Halimaga. So you can see that how a Sandarpana went through different phases and landed up in a stage of Kumbha Kamala, Halimaga, etc. And then the patient lands up in this phase where you just go through the Asadhya Kamala Lakshana, where it gives you the features of liver failure and portal hypertension. Brisham Shunascha Manava, hypoproteinemia, hypoalbuminemia can lead to anasarca or whole body edema. Sarektakshi Mugachardi, so there will be Rekta Chardi, hemoptysis secondary to esophageal varices, bleeding manifestations because of the liver failure, coagulation factor deficiencies, Nashta Agni Sapnyaha, Nashta Agni, Nashta Sapnyaha. Ultimately, the patient ends up in a hepatic encephalopathy, loss of consciousness, and death. Okay. So this is the sequence of metabolic dysfunction associated liver disease as per Ayurvedic perspective. Initially, it starts with Adi Sandarpana, Agni Mandya, etc. leading to obesity, postprandial lethargy, dysmetabolism, insulin resistance, etc. Then there is kapha medo vriddhi, obesity, fatty liver, diabetes, dyslipidemia, etc. And then if at all, if there is Rakta Dushti that happens, then comes the phase of steatohepatitis, portal congestion, hepatosplenic enlargement, and ultimately at the end stage, portal hypertension, variceal bleeding, coagulopathies, etc. etc. If you look at the management strategies, what can we do? So the earlier we get the patient, the best management that we can give, right? So right from the childhood, we have to train individuals to adhere to the dietary habits. So Nidana Parivarjana is the best thing that you can do. And the next one should be, if at all the patient has developed stage 1 fatty liver, then it should be Agni Deepana, Pajana. And whenever we go for that, you should be very sure that you should not insult Rakta when you go for Pajana and Deepana. So maximum possible stick on to Tikta Rasa Pradana Pajana Deepana Dravyas. Because if you go for Kadu, this Kadu can insult Rakta leading to liver problems. So Agni Deepana and Pajana. The next line would be the Kapha Medohara measures. And then comes the Rakta Prasadana, if at all, if you get symptoms pertaining to Rakta Dushti. And then you may be also forced to give Avarana Chikitsa if at all there is Avarana Samprapti that is going on. So that needs repeated Shodhana and Rasayana protocols. And Upadrava Vyadhi Chikitsa, that means if at all the patient comes to you with complications, then you may have to address the complications like Rakta Pitta, Kamala or Udara Chikitsa. So the first line of management will be Nidana Parivarjana. So best possible measures should be advised which are customized to the individual. So a person in Kerala may be using polished rice, but someone in the European diet may be using a bread. So like that we have to identify what is their habit, and then you have to advise these measures. So polished rice, maida, oily, fried, ultra processed foods, excess sugar, refined carbohydrates, alcohol consumption. And we should also train them to follow regular meal timing, because adhyasana or eating food before the previous food is digested is a biggest villain, which totally, dismantles the metabolic mechanism in our body. Daily vyayama, avoid divasapana, all these things everyone knows, right? So you just look at this reference, vyayama nityo jirnashi yava goduma bhojanaha. So yavana, millets, all these things can be given to the patient. Next comes the phase of insulin resistance. Once the patient indicates that there is an insulin resistance, usually the patient will have lethargy, daytime sleepiness, then sometimes increased appetite. So we should treat that in the line of Grahani dosha or Annavisha. So opt for Tikta Pradana Pajana Dravyas like Pajanamrita Kashaya, Shadharana Yoga, etc. You can also go for Kadurasa Pradana. If the patient is Kapha Prakriti, Kapha Pradana Koshta, you can go for Kadurasa Pradana as well. So everything depends upon the patient's attributes. Then you can also address regulated fasting or intermittent fasting. We usually suggest to skip 1 or 2 meals per day. So if the patient is fit enough, we can avoid breakfast and give a brunch, say around 11 or 12 p.m., 11 a.m. or 12 p.m. And evening before 6 we give a meal. So one Annakala is totally taken off. But if the patient cannot take off the breakfast, then you give breakfast and an evening food and skip the lunch. Like that. Whatever you do, you advise the patient to take the night food before 6:30 or 7, not beyond 7 o'clock. This is very, very important. So intermittent fasting can be tried. Then Deepana measures like Chitragadivadi, Agni-Tundi, etc. can be given. And in some individuals who have very Ruksha Koshta, then Pittanubandha, etc., we can also try medicines like Shatpala, Indugandhagrada, etc. Especially in Vada Prakriti individuals, these are beneficial. Then you can also go for Panchagola Yavagu, Mustadi Yavagu, etc., which can be advised as dietary items. This yoga from Charaka Sutra is a very effective one in Sandarpana Janya Vigaras. You can go through this, we can make it as a powder and post it, right? Powder, and you can pack it and keep it in your clinic, and you can use this in different formulation. You can prepare kashaya, you can give it as churna, you can give it as yavagu, like that. Next comes the statotic phase. So here we should go for a full-fledged management of Sandarpana Janya Vigara. So depending upon the patient's indication, you can go for Upavasa, Vamana, Virejana. If the liver is enlarged too much, then it is better to avoid Vamana because it can be very difficult for the patient as well. Virejana, Vasti, Raktamokshana. Then external measures like Udvartana or Udkarshana, this is found to be very much beneficial in reducing the weight. But the only thing is that one cycle of these therapeutic measures may not give enough benefit to the patient. Always give a gap of 3 to 6 months, and you do it repeatedly for 2 to 3 cycles. For example, if you are going for a Virejana, you do it repeatedly. So that is very important. Unless and until all the parameters come back to the normal, repeated measures are always advised. Triphala Kashaya can be used in empty stomach as a cyclic administration. For example, you give Triphala Kashaya in empty stomach for a period of 21 days, then give a gap of around 2 to 3 weeks, again give for another 21 days. So like that, and in between you can also go for a Virejana measure as well. Rukshana is the next measure. You just look at the indication, Abhishanna Mahadosha. So all these Sandarpana can lead to Bahudosha Avastha. So Rukshana is the measure. So next question is how to do Rukshana, right? So then he says for Rukshana therapies, you just go and see Kapha Pitta Prameha Chikitsa. You go and see the treatment of Kapha and Pitta Prameha. So if you look at that, just see the list of medicines that is explained. This is explained in Charaka, Vagbhata, Ashtanga, Sangraha as well. You just look at the Kapha Prameha Chikitsa, Samshodhana Ullekhana Lenkhanani Kale Prayuktani. So it can be Lenkhana, it can be a full-fledged Samshodhana that starts from Vamana, Virejana and Vasti. But these drugs, you look at the drugs, Triphala, Musta, Daru, Haridra, Guduji, Kadirohini, Chitraga and Vidanga. So these drugs can be either used independently or in formulations depending upon the patient's attributes. You just look at the Pitta, Virega, so right, Virega and Shamana, Kadirohini, Trivrit. So all these things are very effective in managing Pitta predominant diseases. And also you can look through the drugs, Guduji, Bhumi Amalaki, Kadirohini, Nimba, Patola, Amalaki. These medicines, for example, SNA itself produces Nishamalagadi Churna, right? So Meheshu Dhatri Nishe is told, right? So Nishamalagadi Churna can be given as a very good hepatoprotective drug as well. So like this, you can incorporate the treatment of Kapha and Pitta Prameha in the management of fatty liver. And in the meantime, we should also not forget the lean ones. So we get a lot of patients who are not obese, but they have fatty liver, right? So again, we have a solution for that. Stula Pramehi Balavan Hega, Krishastadega Paridurbalasya, right? So there is a Stula Pramehi, there is a Krisha Pramehi. So we can always go for Krisha Pramehi Chikitsa, some Brahmanam Tatra Krishasya Karyam, right? I had a patient, a male around 36-year-old who is very lean and he had fatty liver, right? So what we did is, after the initial Dibana Bhajana, we went for administering Shatpala Grida to the patient and in a small dose. And after some 2 to 3 months, so again when I give this in a cyclical manner. You give for 3 weeks, give a break of 2 weeks, and again you give. But provided you should serially monitor the lipid profile and all those stuff. But after that, his appetite came to normal, his energy levels came to normal, and even the LFT and the ultrasound parameters became normal. So it is not that all these Grida preparations are totally contraindicated in these patients. No. In order to correct the metabolic dysfunction, we may have to use these things. provided we assess the patient properly. So Vada Prakriti, Vada Pradhana Koshta. So like that you have to assess and give. So in such patients, Santarpana also is indicated. Next is the fibrotic phase management. So in fibrotic phase, we have to consider Rakta there. So you may have to go for Rakta Pitta, Pradhara or Vada Rakta line of managements. Again, intermittent fasting or Upavasa, Virejana. Again, Nitya Mrudu Virejana is very, very important in such patients. Rakta Mokshana, I have not tried, but it is told in the textbook. Even we can try as research purposes periodic Rakta Mokshana, Siraveda in patients with a fatty liver. But studies have to be done in a controlled manner. You see, Rakta Pitta Hari Chikilsam, Viregam Upavasam cha. And again, these three drugs are important. Trifalaya Prayogo, Shilajadu Prayoga, and Pippali Prayoga. So after the initial Shodhana, you can go for Rasayana measures with these drugs. That is why the term Prayoga is used. Prayoga. So that means it has to be given continuously. That is very, very important. You can also try Rasayana protocols. Guduji, Shilajadu, Trifala, Yashti Madhu is a very good drug that we can try Rasayana protocol in a fixed dose regime, because Yashti Churna is very difficult because in increasing dosage the patient can vomit. So it can be given as a tablet form in a fixed dose regime. Pippali, we all know Pippali is a very good drug for Yagrita and Pliha. So you can go for a Vardhamana Prayoga or a fixed dose regime. But before doing this, you should go for a proper Shodhana measure. Next comes the phase of portal hypertension, right? So here, when there is an advanced portal hypertension, the patient will present to you in an Udara spectrum. So Tasma Nityameva Virejayet, right? So Nitya Virejana is very, very important. Even before ending up in a phase of ascites, in the middle phases of the fatty liver also, Nitya Virejana is a very effective measure. So what you can do is, you can give either a Mrudu Virejana once in a week or on alternate days, that means every third day. Or another thing that we have tried is, give Virejana continuously, Mrudu Virejana continuously for 5 to 6 days or 7 days. Then give a gap of 2 weeks. Then another cycle of 6 to 7 days of Virejana, like that. So usually for practitioners who don't have IP facility, inpatient facility, such things can be tried at home, patient's home itself. So every Sunday is a holiday. So why not you give Avibhatti Churna every Sunday for the next 3 months? So like that, because this will enable correcting the gut microbiome. But the problem is that the patient may go for Virejana on Sundays, and on Monday he may go to a chicken or McDonald's or whatever it is, and they may eat the normal diet. So that should not happen. In the interim period, a proper diet measure and some Samana medicines also should be given. And this Nitya Virejana, it's very, very effective in managing fatty liver. And in some patients, we can also go for Lekhana Vastis. So especially in patients who are obese, you can go for a course of Lekhana Vasti. But a Yoga Vasti protocol of only 3 Kashaya Vastis may not be enough. So you should go for a Kala Vasti format. So you just ask the patient to come and get admitted for a period of 10 days. Do a course of Lekhana Vasti, send him back. After 3 to 4 months, bring him again, give another course of Lekhana Vasti. We have seen that a liver where the enzymes were totally deranged and grade 2 fatty liver has come back to normal after around 6 to 8 months of management. So this is possible, right? So only thing is that the patient and the physician should have some patience and stick on to the therapeutic protocols. Again, diet and lifestyle, I know that all of you might be experts in that. There are a lot of dietary protocols that are mentioned for metabolic syndrome, diabetes, etc., etc. So you can go for all these things. You can substitute millets instead of rice. Then Tikta Pradhana Shakha, that means vegetables which are Tikta Pradhana. Then meal patterns, that is very important, timely meals. Then physical activity. Advising physical activity is very, very important in the management of fatty liver. So if you look at, this is just for an illustration. So a patient comes in this phase where the patient is very early, just going into a phase of insulin resistance. You should address Agni Mandya Nama. So give Panchagola, Trigadu, Chitragadivadi, Shankhavati, or Pajanamrudam Kashayam, Amrudotaram Kashayam, etc. etc. But once the patient has started showing symptoms of Kapha Medo Dushti, then go for Kapha Medohara measures like Asanadi Kashaya, Varadi Kashaya. It is manufactured as Varadi or Varasanadi Kashayas. Then Vidangadi Churna told in Staulya Chikilsa, Navaga Gugulu. Then external treatments like Udvartana, Udgarshana, etc. Lekhana Vastis. So these protocols are indicated for Kapha Medovriddhi. And once the patient landed up in Prameha, then go for measures like Chandraprabha, Nishamalagi, Guduji, Trifala. Even in patients with established diabetes, repeated measures of Virejana has been found to be very effective. But only problem is that you should make sure the patient, if the patient is on insulin, the dose has to be titrated, because we cannot ask the patient to continue the same dose of insulin and undergo Virejana. The patient may develop hypoglycemic episodes. And also most of the patients may have some of the ongoing modern medications. So you should be very aware of the fact that some of the drugs can interact. For example, some of the blood thinners can interact with our Trigadu, Panchakola, etc. So such things should be kept in mind when you give Ayurvedic medicines as add-on therapies. So that is Prameha stage. Next comes the fatty liver stage. Then you incorporate Kamala Chikilsa into that. So Phalatrigadi Kashaya is a very effective drug. Padola Kadirohanyadi, Drakshadi Kashaya, Vashaguluchadi, everything depends upon the patient's dosha and dosha status. For example, if the patient gives you Vada Pitta predominance, go for Drakshadi. If the patient gives you Pitta Kapha predominance, go for Padola Kadirohanyadi. So like that, you have to tailor the medications to the given patient. Arogya Vardhini, Avibhatti Churna. Padola Muladi Churna told in Kushta Chikilsa is an excellent drug. If you you can use it for intermittent Virejana measure as well. But only thing is that it can cause crampy pain in some patients, so be aware of that. Then you should not forget the lean patients. So Shatpala, Tikta Grida or Induganta Grida. Then in some patients we have tried Sugumara Grida because there is no Aniloman and there is Udavarta features. So that is one important point that I forgot to tell is Udavarta, because almost around 60% of the patients who come to us in current practice have some amount of Udavarta. So if Udavarta is present, you have to correct that as well. And once the advanced stage happens, again the Kamala measures has to be advised. And in the end stage, when the patient comes with Udara etc. manifestations, it's always better to go for Udara Chikilsa. So Punarnavadi Kashaya, Nitya Virejana with Gomutra and Trifala Kashaya, Dashamula Panchakola Adikasha, whatever things that you can give in Udara to reduce the Shofa can be tried. So always the drug selection and sequencing should be decided based on the attributes of the patient, including Prakriti, then Koshta, Kala in which you are administering the disease. So all these things will decide how you are going to tailor the treatment to the given patient. So these are the take-home messages. So MAFLD, it can be considered as a Sandarpanajanya disorder. And not to forget that there are some individuals who has history of Apatarpana and can come with fatty liver as well. So we cannot outrightly say that almost all fatty liver cases are Sandarpanajanya. I have seen one or two patients whose history gave Apatarpana, but the patient has fatty liver as well. So in such patients, we may have to tweak our measures, but majority of them are Sandarpanajanya, which includes Meda, Kapha and Rakta. So early correction of Agnimandya, Ama, Annavisha and Meda can prevent the disease progression, and a stage-wise management is always mandatory. There is no single drug therapy for fatty liver in Ayurveda. It is always a multi-pronged strategy which has to be tailored to the given patient. I thank all of you for your patient listening, and I once again thank the organizers for inviting me for this session. Thank you.
Thank you very much, Dr. Mukesh, for that highly informative and insightful presentation. We sincerely appreciate your valuable time and acknowledge shared with all of us. Now, we are delighted to welcome you all to the next session of our Oushadha Sameeksha monthly Ayurveda seminar on on the 14th August, Friday from 4 p.m. Our next webinar will explore Another important and clinically relevant topic, leech therapy and experiences. The session will be delivered by our distinguished speaker, Dr. Preeti Chabra, an eminent Ayurvedic consultant who has been practicing in Delhi for the past 33 years. She specializes in Panchakarma therapies, Ayurvedic gynecology, Agni Karma, and leech therapy, and is a pioneer in introducing Suvarna Prashan in Delhi. She currently serves as a senior consultant at prestigious Sir Ganga Ram Hospital, New Delhi, and also the director and senior consultant at Sri Krishna Super Specialty Institute of Ayurveda, New Delhi. In addition, she is a Chikitsak Guru at Rashtriya Ayurveda Vidyapith, an autonomous organization under the Ministry of Ayush, Government of India. We shall now move on to the SNA product presentation, where we will introduce selected Ayurvedic formulations from SNA that are relevant to today's topic. I request Dr. Ansri Muralidharan, Manager QC and QA SNA Oushadhasala, to begin the presentation.
Hi everyone, I'm Dr. Anushree Muralidharan. Today I would like to present few SNA medicines for effective fatty liver management. Am I audible? First kashaya is Vasha Gulichari Kashaya. Its reference is in Sahasra Yoga and traditionally used for liver disorders, especially Kamala and Pandu Roga. It is also employed in conditions involving metabolic derangement and fatty liver changes. It is also mentioned in Ashtanga Hridayam Chikitsasthana Panturoka. Its ingredients are Vasa, Gudichi, Triphala, Katuki, Goonimba, and Nimba. Its doses 15 to 20 ml kashaya mixed with 3 times of lukewarm water. Anupana, commonly prescribed Anupana is honey. Usually, it is indicated in Kamala, Panturoka, Yagrutroka, and Raktapitta. It is strongly indicated for liver dysfunction, metabolic corrections, and disorders linked to Pitta Kapha aggravation with abnormal lipid metabolism like fatty liver, dyslipidemia, hyperlipidemia, obesity, and metabolic syndrome. Predominantly Pitta Kapha Shamaka, Rakta Prasatana, it has got hepatosupportive action. It is Yakrut Balya. It is Tikta Kashaya Rasa Pradhana, Lagu Ruksha, and slightly Shita Virya. Now let us see few studies done, an article published about Vasha Gulichari Kashaya and its efficacy in treating NASH. It is published in Journal of Ethnopharmacology. So the key findings of the study is, this study yielded 3 signaling pathways related to NASH, non-alcoholic steatohepatitis, which is a complication of non-alcoholic fatty liver disease, on which Vasha Gulichari Kashayam has maximum effect, bringing up a probable alternative treatment for NASH. And this study identified 55 compounds, confirmed 10 by analytical methods, and found significant target interaction linked to NASH pathways. And the formulation improved dyslipidemia, insulin sensitivity, steatohepatitis, and liver histology compared with saturglitazone, which is an oral medication used to manage diabetic dyslipidemia, hypertriglyceridemia, and non-alcoholic fatty liver disease. So this makes it a highly relevant classical formulation to mention for fatty liver, liver health, metabolic syndrome, and obesity-linked liver disease. Moving on to next product, Buda3 by SNA Oushadhasala. It is a patented product of SNA Oushadhasala, and this syrup is positioned as a hepatosupportive and metabolism corrective formulation. Its ingredients are Bhumi Amalaki, Daru Haridra, Musta, and Saripa. The adult dose is 5 to 10 ml thrice daily or as directed by the physician. It helps in improving liver health, digestion, and metabolic balance, especially where fatty liver changes occurs. It is generally considered useful in fatty liver, reduced appetite, sluggish digestion, and liver dysfunction associated with abnormal lipid handling. There is no as such clinical study done on Buda3, but the clinical efficacy and safety of berberine in treatment of non-alcoholic fatty liver disease. A study is there, and berberine is one of the active compound found in daruharitra, which is one of the major ingredient of Bhudatri syrup. This article concludes that berberine has promising therapeutic potential as an adjunct treatment for fatty liver disease because of its improved liver enzyme, lipid profile, insulin resistance, and BMI in pooled clinical trials. Yet another study about Phyllanthus neruri, which is also one of the major ingredient of Bhutatri, is seen and published in Helion. The study is done to find the effect on 1 year supplementation with Phyllanthus neruri on fibrosis scores and metabolic markers in patients with non-alcoholic fatty liver disease. And it showed a significant improvement in fibrosis score. Moving on to one of the very common and much prescribed formulation, Avipati Churna. It is a classical Ayurvedic formulation used chiefly to pacify aggravated pitta and support digestion. And as we all know, it is also prescribed in hyperacidity, burning sensation, constipation, and other pitta predominant disorders with a mild purgative and digestive corrective action. Let's see its ingredients. It contains Trikadu, Ela, Twak, Patra, Musta, Vidanka, Amalaki, Trivrit, and Sita. Its dose is 5 to 15 gram early in morning or bedtime with honey or lukewarm water. Indications. It is indicated in pitta disorders, indigestion, nausea, acidity, and burning sensation in addition to its action in fatty liver. Its properties are: it is Pitta Kapha Shamaka, Deepana, Virechana, Shrotoshotana, Yakrip Prasatana, and is Tikta Madhura Kadarasa Pratana, Ruksha, and Shitoshna. In the context of fatty liver management, Operculina turpatum, which is Trivrit, root extract show hepatoprotective and antifibrotic activity in animal studies, reducing toxic liver injury and fibrogenic damage. So Trivrit has a supportive evidence in fatty liver, mainly through Virechana, and in Avipati Churna, Trivrit is about 36% or more is the Trivrit. And Avipati Churna is usually not taken alone. It is usually taken along with multiple other drugs. And a study titled Effect of Ayurveda Intervention in Non-Alcoholic Grade 2 Fatty Liver Associated with Obesity, a case report, was published in Journal of Ayurveda and Integrative Medicine. And this study design was the study was done with Avipati Churna, Punardava Mantura, Shankabasma, and Triphala Churna, Katiki Churna in different phases was given to an obese male with grade 2 fatty liver for 60 days. And the key findings after 2 months was a complete resolution of fatty liver on ultrasound, as well as normalization of ALT, triglycerides, cholesterol, LDL, and fasting glucose, and significant BMI reduction and symptom improvement. So this is a case report, but it gives a detailed evidence that a classical Ayurvedic protocol can reverse fatty liver in an individual patient. Moving on to the next product from SNA, Patola Kadirohinyadi Kashaya, which is usually prescribed in skin disease, jaundice, fever, itching, nausea, and liver related ailments. And this formulation is known for its cleansing, anti-inflammatory, and liver supportive effect, and is especially useful where inflammation, discoloration, or digestive and hepatobiliary imbalance are present. And its ingredients are patola, katuki, chantana, madhusrava, gutuchi, and pata. Its doses 5 to 20 ml mixed with lukewarm water, 3 times of lukewarm water. Usually it is indicated in kushta, jwara, visha, chardi, arochaka, kamala, visarpa, visha, and skin manifestation due to liver disease, fatty liver, etc. It is strongly indicated for liver dysfunction, metabolic correction, and disorders linked to kapha pitta aggravation, with abnormal lipid metabolism like fatty liver, dyslipidemia, hyperlipidemia, obesity, and metabolic syndrome. So this medicine has a special action on liver. It helps remove the metabolic waste and help reduce elevated bilirubin. And its properties are it is Kapha Shamaka, Ruksha, Virechaka, Kushtadna, Vishahara, Yakrit Prasatana, and Yakrit Balya. It is Tikta Rasa Pratana, Lagu, and Ruksha. A study about Patola Katurohinati Kashaya and its effect on non-alcoholic fatty liver disease. A case study was published in International Journal of Ayurveda and Pharma Research, which details about its effect in liver disease and fatty liver metabolic condition with evidence of improved liver enzymes and lipid parameters. The study reports significant reduction in blood sugar, serum lipids, liver enzymes, weight, and BMI, indicating its efficacy in fatty liver related metabolic dysfunctions. And SNA has got Patola Katurohinia the Kashaya tablets as well, and it has to be taken with warm water before food, and its adult dose is 1 to 2 tablets twice daily, and its duration is 2 to 4 weeks or as advised by your physician. So these are the much common medications from SNA Oushadhasala used in fatty liver treatment. And I could see all these medicines were explained, told by the sir, Mukesh sir, in his presentation. And I would say it was one of the very detailed and excellent presentation on fatty liver management. Thank you, sir.
Thank you, Dr. Anusri, for the informative product presentation. We now move into the interactive question and answer section. Participants can type their questions in the Q&A section. Already we have some questions in the Q&A. Mukesh, doctor, one of the question is, in chronic liver failure, what is advisable and how to demonstrate the Halimek stage? Do you need liver transplantation or not?
Am I audible? Yeah.
Yes.
The chronic liver failure stage, Halimaga can be considered as a stage of chronic liver failure before the end stage failure happens. Okay, it can be something in between the compensated and decompensated phase. So in such phases, a complete reversibility may not be possible, but we can go with the Kamala and Udara Chikitsa in such patients. But once the decompensated phase happens, then it is very difficult to manage the case. We can slightly prolong the lifespan, and we can give some medicines to improve the quality of life, but most of the patients may end up with liver transplant if other indicators are okay for transplant. But most of the times the patient will have concurrent illness like diabetes, diabetic nephropathy, etc., etc. So transplant may not be possible. In such patients, we can continue giving our treatment as a Udara, Kamala, and Rakta Pitta Chikitsa.
One another question from Rajlashmi is, apart from Nidana, what is the influence of age and gender of patient in fatty liver?
Age and gender, as I told earlier, before people in their late 30s or 40s used to come with fatty liver, but now they are coming in the early 20s or even beyond 15 to 20 years of age. That is the one thing. Second thing is, females, the prevalence of fatty liver in female is slightly lesser when compared to men in their premenopausal phase, because there is some theory that the estrogen has a protective mechanism. But after the menopause happens, then they catch up with the males, so that the prevalence is almost equal. So if you look at premenopausal period, then the males they are more prone, but after the menopause both are equal in the prevalence of fatty liver. So that is two things that I can say.
One another question from Dr. R.B. Gojia is, a female patient aged 42 years having DM type 2 hypertension and grade 1 fatty liver. Also, she is suffering from udvartana and enlargement of abdomen after food. Whenever giving katu pachana, patient having hyperacidity, and giving tikta panchana, patient's enlargement of abdomen after food is increasing. What to do in this kind of patients?
Then for the first thing that you can do is to try and give an Udavartahara Vasti. If the upper part is not say possible, then try the lower part. So that means you go from below. So give a Udavartahara Vasti and then try. Then go for Tikta Bhajana from the top. Again, medicines like Saptasaram Kashayam can be given because that is Vadanulomana as well as it doesn't increase Pitta. And you can modulate the Anubana of Saptasara according to the patient's condition. So that can also be tried.
One another question is, are there clinical features or investigations that help you to identify patients who are progressing from simple steatosis to inflammatory disease before advanced fibrosis develops?
Usually, serially monitoring the liver function test is one possibility, and second one is the cardiac risk predictor HSCRP, high sensitive C-reactive protein, can be used, but that is generally used for cardiac risk prediction. But if even if there is a microinflammation that is going on, HSCRP can be raised, so that can be used as another indicator. The best thing is to do an LFT and an ultrasound every 6 months. That will suffice.
And one question from Kishore Goyal is, in acute liver failure, what may be the protocol? Should
In
it be
acute,
related to Kumbh Kamala?
in acute liver failure, it is always better to refer to the patient to a gastroenterologist. We don't have anything much to do in acute liver failure because the patient can have hepatic encephalopathy and related complications, and the patient may also need platelet infusions and a lot of things may be needed. So it is better to refer.
So one another Indu Goyal is asking, please discuss with some case history.
Yeah, usually in my sessions I discuss using case histories, but today I didn't have enough time, so that's why there are a lot of case records with us. If you can contact personally, I can give you that as well.
And also same from Indu Goyal.
Because the thing is that I may use one medicine in one patient, but that same medicine may not be fit in the patient that sits in front of you. So what I can give is only options, because we doctors, modern knowledge has corrupted our Ayurvedic approach up to some extent, so that we try to learn one medicine is equal to one disease, but that's not possible in Ayurvedic practice. So I can give you a list of medicines that can be used as presented here. Dr. Anushri has presented some drugs like that. I can give you a list, and I can also give you some algorithms that if this is the koshta, this can be the medicine, like that. So later on, the treatment has to be customized to the given patient.
And one another from Dr. Babu. What is the logic in advising Avipatti Churna with honey for?
No, it can be given, no problem. What is the issue in that? It depends upon the purpose, because Avipatti Churnam has two types of action depending upon the dose. If you increase the dose, it will act as a Virejana. If you give in small doses, it can act as a Pitta Shamana as well. Anubana, the said Anubana is, the explained Anubana is Kshaudrena Gudigigrida, so it has to be given with honey, right? So it can be given with honey, it can be given with milk, it can be given with warm water. That depends upon the patient's indication.
Okay, I think the questions are over. Lecture sections. Thank you, Dr. Mukesh, for patiently answering the questions and sharing your valuable expertise. As we come to the end of today's session, it has truly been enriching academic experience filled with knowledge, insights, and meaningful discussions. I now invite Ms. Nisha Sunil, Manager, Digital Media and E-Commerce, SNA, to deliver the vote of thanks. Ma'am, over to you.
Respected speaker, moderator, esteemed participants, ladies and gentlemen, good evening. As we come to the end of today's enlightening webinar, it's my privilege to propose the vote of thanks on behalf of SNA Oushadhasala Private Limited. First and foremost, I express our sincere gratitude to our esteemed speaker, Dr. Mukesh, Professor, Department of Roganidana, VPSV Ayurveda College, Kottakkal, for delivering such an insightful and informative session on fatty liver and its management in Ayurveda. Your deep knowledge, practical approach, and valuable clinical perspective have enriched all of us. Thank you, sir, for graciously sharing your expertise and taking the time to answer our participants' questions. I would also like to extend my heartfelt thanks to our moderator, Dr. Anushree Muralidharan, Manager QC and QA, SNA Oushadhasala, for her excellent product presentation. A special word of appreciation goes to all our participants, Ayurveda physicians, academicians, researchers, students, healthcare professionals, and special dignitaries from across India and abroad. Your enthusiastic participation, thoughtful questions, and active engagement made today's webinar truly meaningful. We hope the knowledge shared today will be valuable in your academic and clinical practice. I would also like to thank the management of SNA Oushadhasala, our organizing team, technical support team, and everyone working behind the scenes for their dedication and efforts in making this webinar a success. Finally, I invite all of you to continue being part of SNA Oushadha Sameeksha monthly Ayurveda webinar series. We look forward to your participation in our upcoming sessions as we continue our journey of learning, sharing knowledge, and promoting the timeless wisdom of Ayurveda. Once again, thank you all for your valuable time and participation.
Did we share about our next program?
Program is on 14 August about the topic of